All right. So she's a senior lecturer in the Department of Clinical Pharmacology, College of Medicine, University of Lagos, and she's also an honorary consultant neurologist at the Lagos University Teaching Hospital. She's very much interested in lifestyle medicine. I remember one day she called me up and she asked me a question. You know, she was a bit concerned. One of the things that Duni told me that day was that she's seen her patients who have strokes coming back with second strokes. And these people are on medication. They're on 2, 3, 4 medication. And, you know, she was really concerned that why is this happening with people who already know why they're having the stroke? They're already on several medication, and yet they're coming back with a second and third stroke. So I'm sure she's going to throw more light on this tonight. And I'm also going to be sharing a few tips with us as well. So I give to you Dr. Duni. Dr. Duni Olusanya. You have the floor.
Muted. Good evening, everyone. Thank you very much, Dr. Makinde, for giving me the opportunity to talk about what I'm about protecting your brain secrets to preventing stroke. I am trying to see if I can share. I'm not seeing. Well, I thought I had
the slide
access.
icon.
I thought I was able to share earlier. I did a trial. What's happening?
Yes, you should be able to.
Okay, I can see it
You're
now.
a co-host. You should be able to share.
Okay.
Okay.
Okay, can you see my slides clearly?
Yes, we can. Very
Okay.
clear.
Okay, so once again, thank you very much, Dr. Makinde, and I thank everyone attending this call. My name is Dr. Adeduni Olusoya, like she mentioned, and I'll be talking about protect your brain secrets to preventing stroke. I'll go through a brief introduction. We'll talk about stroke in numbers, why we are talking about stroke. We'll talk briefly about the risk factors for stroke, and we'll go to the main topic of today, preventing stroke. So I'm sure if I ask everybody here what is stroke, all of us know what stroke is, but to clarify, to make it simpler, stroke typically is a disease of the brain that usually starts suddenly, and it occurs because there is a problem to blood supply in one part of the brain. And that problem to blood supply could either be due to a blood clot, and that is what we call ischemic stroke, or due to the rupture of a blood vessel, and that is what we call hemorrhagic stroke. So again, sudden onset of neurological deficits attributed to a vascular injury to the central nervous system. Two major kinds: ischemic stroke and hemorrhagic stroke. Ischemic is when there is a blockage of blood flow to some part of the brain because of a blood clot, whereas hemorrhagic is when a blood vessel ruptures and you have blood being compromised to the distal part. Again, if I ask all of us, how do we know that someone has had a stroke? The person usually is fine this moment, then the next moment they complain of sudden onset of usually weakness of the face, arm, leg, usually on one side of the body, or problems with speech difficulty. They find it difficult to speak the right words. Sometimes they don't understand you. Sometimes the speech is slurred. Sometimes they complain that they are not seeing from one side of their visual field. They are running into objects they can't see from one side of the face. And sometimes they complain of problems with balance. So yes, the power is fine. If you check the legs, the legs are strong, but somehow they cannot maintain balance enough to walk. They feel they are going to fall. Sometimes it is sudden onset of headaches. Usually when you talk about, it's more common in people who have the hemorrhagic stroke. That's the one due to blood, the rupture of the blood vessel, very severe headache, vomiting, double vision, dizziness. So these are the basic symptoms of stroke. And usually we say, and you can see this be fast. You will see the last part is the T represents time to act, time to call, time for immediate attention, to call to seek for immediate medical attention. Because if you don't work fast when a patient has stroke, the outcome is not usually so fantastic. And again, this is another slide talking about the signs of stroke in men and women. Now, talking about stroke in numbers, like I said, I'm sure most of us know what stroke is. And the reason is because almost all of us have come into contact with someone who has had a stroke. Now, talking about the numbers, globally, when you talk about the number of deaths, second leading cause of death globally, third leading cause of death and disability combined globally. And unfortunately, when you talk about stroke over the years, the incidence of stroke is not getting better. So we are having more people with stroke nowadays compared to before. So in the past 30 years, 1990 to 2021, the rate of incident strokes has increased by 70%, which is massive. And more people are dying from stroke compared to about 30 years ago. And more people are suffering disability as a result of stroke. So it is saying it is a time to act. Again, when you compare these figures with what is happening in other climes, it is not also good. So when we compare our burden of stroke in Africa, in low to middle income countries compared to the Western countries, this death that is occurring from stroke, it's coming mainly from our side. 87.2% of death from stroke come from our side. The disability adjusted life years, it is coming from our side to the low to middle income countries like Nigeria. It is said that about 101 people are living with stroke globally. 12.2 new strokes occur each year. And 90% of all strokes are linked to 10 modifier risk factors. So when I go down, we'll talk about these risk factors. You can see Nigeria is not left behind. We can see the pink 20 to 60 per 100,000 population. I dare say this is not really the figure, because data collection in this part of the world is still not optimal. And we have a very high mortality, about 20 to 30% of people who have stroke, that's the people who are admitted in the hospital, actually die because of stroke. We are not talking about people who are not presenting at the hospital. We are not talking about people who go to other places to seek care. So like I mentioned, there are different kinds of stroke: ischemic stroke, hemorrhagic stroke. Ischemic stroke, like I said, due to the blockage of blood vessels as a result of blood clots, which could be from other arteries, maybe arteries in the brain. Blood clots could occur from the heart. It could occur from arteries in the neck and some other parts of the body. Whereas the hemorrhagic stroke, broadly divided into intracerebral hemorrhage, that's when someone bleeds into the brain substance, and subarachnoid hemorrhage. Yes, there's bleeding quite right, but this bleeding is occurring affecting the blood vessel inside one of the layers of the brain. So we have about 33% of people suffering from hemorrhagic stroke. Now, if you compare the two, people with ischemic stroke are likely going to survive compared to the relatively uncommon hemorrhagic stroke. None is uncommon though, but if 100 people have ischemic stroke, maybe 30 to 40% of them will die. Whereas for intracerebral hemorrhage and subarachnoid hemorrhage, you could have mortalities as high as 70%. So the figures are not too good, and that is why we are talking about stroke. So why do people have stroke? That's why we're talking. That's what we mean by risk factors. Who are those who are more likely going to suffer from a stroke? And that has been classified broadly into modifiable and non-modifiable risk factor. Modifiable are factors you can do something about. Non-modifiable factors, risk factors are, it's there. There isn't much anybody could do about that. So talking about modifiable risk factor, you can see hypertension is number one, diabetes, low density lipoprotein, that's one kind of cholesterol that is called the bad cholesterol. When people take diet high in salt, I'm sure Africans are not behind when you talk about eating a lot of salt. If there's no salt, the food is not sweet. Kidney dysfunction, people who have chronic kidney disease of any form are at the high risk of suffering from a stroke. People are on the big side, excess body weight, obesity is a risk factor for having stroke. Air pollution, we cannot relate with that. Smoke from generator, from car, exhaust pipes, and all of that are all causes of air pollution, and there are known risk factors for developing stroke. Smoking, physical inactivity, harmful use of alcohol. Maybe we shouldn't call that harmful use of alcohol. Maybe we should just say use of alcohol. I will expatiate on that later. There are other modifiable risk factors. I won't dwell so much on them. But if you look at the last line, we are seeing if you look at the last line, we are seeing thrombotic states, oral contraceptive pills, hormones, NSAIDs are drugs like aspirin, drugs, high doses of aspirin, ibuprofen, diclofenac. So am I saying we shouldn't use these drugs? No, we should just be cautious when we use the medications. We should work with medical experts when we take these medications. Then we talk about the non-modifiable risk factors like advancing age. The older people get, the more likely they are going to have a stroke. I remember a few years ago, we were talking about age 50, 60, 70 as people who are at higher risk of stroke. But the numbers are dropping over the years. We are seeing 30-year-olds, we are seeing 20-year-olds, we are even seeing 17, 18-year-old people coming down with stroke. So advancing age, yes, but again, we are having more people who are young having stroke, again, because of the risk factors we talked about. More common in male. Family history, if someone has had a history of stroke in the family, it is likely another person has. Then the last line, Africans, African Americans, and Asians. Somehow Africans, genes, composition, puts us at the higher risk of having a stroke, and again, more severe stroke was outcome. So we've talked about stroke, we've talked about the risk factors, we've talked about the modifiable, the non-modifiable risk factors. So what we are going to talk, why we are talking about all of this is we don't want any of us to have a stroke. So that's why we are talking about the secrets. The secrets, it's meant to be a secret of preventing stroke. Generally, we talk about primary, secondary stroke prevention. People talk about primordial stroke prevention. People talk about tertiary stroke prevention, but I'm not going to hammer on that. But in case we have policymakers around us, yes, for LCI too, we could, champion primordial prevention of stroke, in which we try to drive policies that will favor people from developing the risk of stroke. So we are going to drive policy like safe environment for exercise, preventing air pollution, catching them young, as in preventing children from having childhood obesity, do drive so that alcohol would not be easy to access, or tobacco. Those things will be, maybe higher tax, people not having easy access to some of these things that could increase their risk of having stroke. Now, talking about primary prevention. So we are talking about preventing stroke in people who have not had a stroke, but who have the risk factors. I talked about the different risk factors. Then we're talking about secondary. So we're talking about early intervention that will prevent the stroke from getting worse, as well as having a repeat stroke. Then tertiary is when complications have occurred, but you still want to manage so that the patient won't advance and progress. So I've mention the different kinds of prevention. So we talk about primary stroke prevention. And again, we said we are targeting people who have the risk factor. And what we do lifestyles at the population levels and to encourage individuals to take on healthy habits so that stroke can be prevented. Then we talk about drug treatment of risk factor. This slide looks very familiar. I'm sure we saw it before. Modifiable risk factor, hypertension, 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 hypertension. It is said that hypertension is the single most important risk factor for stroke, but for both hemorrhagic and ischemic stroke. They say that 50% of people with ischemic stroke are more likely have hypertension as a risk factor, whereas about 70% of people who have hemorrhagic stroke have hypertension as a risk factor. So if you eliminate hypertension in the population, we are saying we can reduce the incidence of stroke by almost 60%. So hypertension is one of the strongest modifiable risk factor that we'll talk about. In my next slide, I'll talk more about hypertension. Diabetes, high levels of LDL cholesterol. So I'm taking these three together. When we talk about modifying these risk factors, diabetes, high levels of lipid, LDL cholesterol, there's nothing to be worried about because people actually have these three diseases together. And most of what we talk about when we talk about lifestyle modification for these three, actually it is the same lifestyle modification that works for each of them. So you're not going to look for a lifestyle modification that is totally different from hypertension, diabetes, or high density lipoprotein, high levels of that. No, the same risk factor modification, lifestyle modification works. There's an overlap in all the lifestyle modification for all of them, so we don't have to be scared. Then the other issue is, yes, we've been talking about stroke. When we talk about lifestyle modification for stroke, the same thing applies to heart failure because all these conditions too are the same thing that are likely going to cause people to have heart failure. The same thing with kidney problems. So it is not just one disease. It is about adopting habits that will prevent these complications that we are talking about. They are all called cerebrovascular diseases. Again, I lump those three together because it is not just about do this, not do that, the lifestyle aspect. By the time people are making a diagnosis of hypertension, we are talking about that is the time to start taking medication. So for this, we're talking about lifestyle modification for them and drug treatment. So by the time someone's blood pressure is consistently higher than consistently at 140/90 millimeters of mercury, at more than two or more readings, then that is the time to start treatment. That is not the time to do lifestyle modification alone. But if you're adding 120, 130, it is good to start. Diabetes mellitus, by the time a definite diagnosis of diabetes is made, that is the time treatment with drugs are indicated. Whereas if you're having levels borderline that we call pre-diabetes, lifestyle works at that point. So lifestyle at the pre-diabetes state, lifestyle and drugs when a definite diagnosis is made. Again, levels of cholesterol at some level, usually about 190 milligram per dl, you might at lower levels, you might talk about lifestyle, but when it is bigger, when it is higher than that, you might have to start medication. Again, LDL is not absolute 190 milligram per dl. Sometimes if a patient already has a stroke, has some other comorbidities, you might want to start at a much lower level. So what I'm saying is there's a place for lifestyle, there's a place for medication. They are all working together so that the patient can get the best. Then we'll talk about diet high in sodium. All of us Africans, at least I know quite a number of us, if you go to Mama Put, if you go to the eateries, even if you go to the high-end restaurants and all of that, salt has to be in the food. If the salt is not there, the food is not sweet. So Low salt diet is quite important to prevent the risk of hypertension, especially in Black, because it is said that hypertension is volume dependent and that will reduce the risk of both stroke, hypertension, and all other medical conditions, all other cerebrovascular diseases. So how do I know my salt is too much? If I eat my food and I taste the salt, it is too much. If I can eat rice without salt, then I'm doing well. But if I can't eat rice without adding salt, it tells me that I'm taking a little bit too much. If I can eat Indomie noodles comfortably without complaining, it tells me I'm taking too much salt. So what's the recommendation? Start reducing your salt intake. We won't say stop taking salt, but start reducing gradually to the lowest level you can tolerate. Kidney dysfunction is another risk factor for stroke. If someone has a kidney disease, it's good you see your doctor for both lifestyle modification as well as proper treatment. Excess body weight, I'm sure all of us know a lot about that, but usually we want to target a BMI around 24.9, about 18.5 to 24.9, so that the weight will be adequate. I'll talk more about that. Air pollution isn't much we can do about that. It has to be at the level of policy makers, preventing generator, limitation on the number of years of cars you use and all of that. Now, smoking is something we can address ourselves. So if someone is smoking, it is time to stop, because it's been known that smoking increases the risk of having stroke, hypertension, all the other cerebrovascular diseases. And if someone stops, the risk it reduces significantly. Physical inactivity, yes, some people can be exercising 30 minutes, 5 times a week, 150 minutes in a week, but the rest of the day they are seated at one place. So every 30 to 45 minutes, it's important people walk around, because exercise is independent of physical activity. So walking, being active, exercise, as well as preventing sedentary lifestyle are risk factors to modify. Harmful use of alcohol, like I said, maybe we should just say use of alcohol. A few years ago, we used to say for a low concentration, a low quantity of alcohol is preventive, but recent WHO guideline says no, alcohol increases the risk of having stroke. So it's a no, no, no now. Hypertension, again, the single most important risk factor for stroke. If someone has hypertension, if they are saying your blood pressure is 140/90 on 2 or more occasions, that is the time to start treatment. Of course, you work together with the lifestyle modification we've talked about. Primary prevention strategies, addressing risk factors. I've talked about the drug aspect. You need the experts there, as well as the lifestyle aspect. I've talked about low salt diet. Then we'll talk about Mediterranean diets. I'll talk about that in my next slide. Exercise. Usually it's recommended that you have about 150 minutes of exercise in a week. So that means 30 minutes at least 5 times in a week. Moderate to high intensity exercise. So you ask quite a number of people, do you exercise? And the answer is usually yes. So how do you exercise? Of course, I go to work, I climb the staircase and all of that. So the next question we typically ask is, when you climb this staircase, when you walk around at work, do you feel your heart beating fast? Do you feel a bit as if you need to catch your breath? They are saying no. So that is not the exercise we are recommending. Yes, walking around is good. It has its place. But again, exercise should be good enough, or you should be able to get your heart pumping fast enough to say someone is exercising. So we are talking of things like running, jogging, brisk walk, usually good enough to make your heart beat fast and to make you know that you've exerted some energy. If you've not been exercising before, this is the time to start. But I won't say we should start with 30 minutes every day, 5 times a week. You could start with 5 to 10 minutes every day, then you build up gradually to the minimum of 30 minutes, at least 5 times in a week. No sedentary lifestyle, I've mentioned that earlier. Weight reduction, I'll talk about that. Sleep, abstinence from tobacco, I've talked about that. I've mentioned no alcohol. You can see my image clearly. We are seeing 50%. This is Mediterranean diet. 50% fruits and not starchy vegetables, 25% protein, 25% carbohydrate. Generally, it's recommended if you do 30, 30, 30 of each, that is good enough. If you do 30, 30 of which is good enough. So 30% fruits, vegetables, 30% of protein, 30% of carbohydrates. So it's easier to work with that. So what it means is that one of my meals in a day can just be fruits and vegetables. Okay? Usually we'll mix the carbohydrates and protein side by side, 50-50. So do whatever works for you, but just make sure you have high amounts of fruits and vegetables, legumes, olive oil, the principal source of fat, yes, but I know it's expensive. We can still get healthier low cholesterol oil, moderate consumption of fish and poultry, and minimal intake of red meat and dairy. So usually we say it is better to take fish, then you can take chicken, goat meat, then finally you can talk about eating beef. And when you talk of beef, and beef, cow meat, we are talking about beef, not the roundabout, all those stripes and all of that. No, we are talking about beef. All those things, the other parts should be once in a blue moon. Red wine, in those days recommended, but like I said, recent guideline by the WHO says no to alcohol. Then try to include nuts in your diet. I've mentioned this several times, 150 minutes per week of moderate to vigorous activity. So it has to, the exercise you're doing should be able to make your heart pump fast for you to be able to catch your breath. I talked about brisk walk, exercise, jogging, running. Dance could actually do that for some people. If you dance fast enough, it could make your heart beat fast and pump fast enough. Of course, we talked about sedentary behavior. Avoid sitting at a point for too long. You try to take a short walk, stretch, pace up and down a point for about 30 to 45 minutes. When you've sat down for about 30 to 45 minutes. So you do that every 30 to 45 minutes, especially people who have to sit at some points practically throughout the day. Like we said, BMI, body mass index, usually you calculate that by dividing your weight in kilogram by your height in meters square. So if you calculate that, your weight should be between 18.5 to 24. Your BMI should be between 18.5 to 24.9 kilogram per meter square. If you're not getting that, it is time to start working on reducing the weight. Again, diet, exercise, and all of that have been known to help. Usually they count calories. Then finally, we talk about sleep. I know there are lots of stories out there. I saw a social media, one of those reels that they show around. Someone said, oh, you sleep, you should not sleep so that you can be rich. Another person said you should sleep so that you won't die young, all sorts of things. But what we are just saying is try to sleep 7 to 9 hours per night. 7 hours at the lower level and 9 hours at the extreme. And sleep is refreshing. It helps the body to regain its energy. It helps to reduce inflammation. Poor sleep too have been known to contribute to the risk of having hypertension, especially in the setting of sleep apnea. So these are other things to pay attention to. So these are my references. I want to thank you all for listening. Thank you very much.
Wow, wow, wow. Amazing. Thank you so much, Dr. Lusanya, for that very insightful presentation, taking us through the how and why we should not actually develop a stroke. I think it's clear from this presentation that there are so many things that are modifiable in our lifestyle. And I'm going to share a little bit more light just to quicken our attention, especially on some practical tips and some things that we can actually do, on a day-to-day basis, to ensure that we adopt a healthy lifestyle. So please, you can begin to drop your questions in the chat box. Please drop your questions in the chat box for Dr. Olusoya. And I want to welcome everyone who is just joining us. This is Lifestyle Champions International, and we are empowering individuals to live a healthy lifestyle every day by adopting lifestyle choices on a daily basis. You're not going for a party and saying, oh, because I'm in the party today, let me cheat very well. Because I've heard people say that. But when it becomes a lifestyle, yeah, it means you're even enjoying, whatever you are doing, because you have given attention to your taste buds. And by giving attention to your taste buds, you are able to actually reduce your affinity, for certain foods. Okay, so let me also share my screen, just to give us more of a pep talk. Okay, please kindly confirm that you can see my screen. Okay, can you see my screen?
Yes.
Yes, we can.
Yes.
Yes, we can.
Okay, so I really want us to think inwardly, do a bit of reflection. What happens when you get home every evening after work? Do you find yourself exhausted? You just want to lie in the couch, or you put on the TV and you just fall asleep in front of the TV, or you find out that you have more energy to be able to relate with the family and do some other things. One of the things I realized at some point was that if I was at work and then in traffic for a while and I got home exhausted, what will actually give me energy was to take a walk around the house, and not just to go and sit down and put my legs up and say, oh my goodness, I'm so tired, I've had a long day. It was walking around my house, that would give me a fresh burst of energy, and I'll find out that I can do much more than just, lay around. So this photo shows two people who retired at 65. So we encounter different people in the hospital. We see people who have had a stroke, for example. We see people who are in their 80s. In fact, today I still saw a woman, an 84-year-old woman, and she was complaining of pain in her shoulders. And she said she's so fine, her BP is fine, blood sugar fine, everything is just this pain in her shoulders. Of course, it was arthritis. Whereas some people are 60 or 65, they've had a stroke. In fact, one of the reasons why we are having this webinar today is because one of my colleagues in LASUS, she was looking a bit downcast, about 2 weeks ago. And she said that she has just been called to see a 49-year-old man with a hemorrhagic stroke. And she said the prognosis is poor. And she's so sad because it was basically his lifestyle. It just had to do with not checking his blood pressure, not doing the lifestyle strategies that can control the blood pressure. And people are placed on medication. They think, oh, I've used it for 1 week. Oh, bye-bye, I'm fine. So we take our work seriously. We take our education seriously. We go and we get those degrees. Can we please get a degree in caring for ourselves? Make sure you are healthy enough to enjoy this body that God has given you. I tell people, our bodies are the temple of the living God. It's not when we're talking about adultery and fornication that you say that you are, keeping your body, the way God wants. If you are drinking those high sugary drinks that are damaging your cells and causing oxidative stress and driving a lot of the poor immunity that we're seeing, and of course, increasing our risk of many of these conditions, then we are not actually doing due diligence. So it's important for us to understand that the root cause of disease is what we need to address. And that's why our behavior is important. Chronic diseases have been linked to stress, poor diet, physical inactivity, excess weight, tobacco, alcohol use, poor sleep. Those are the things that Dr. Olusonya has, hammered on today. And those are the root causes of the diseases. And that's why you will see one person having 3 conditions at the same time. So why is it that this same person has diabetes, has high lipids, also has high blood pressure, and maybe in addition now develops a cancer? So they are the same conditions driving, these diseases, even though we know there's a genetic component. Even if you look at this diagram here, you can see that we have genetics, we have genetic predispositions, but now we have studies that show that you can step down certain parts of your gene so that you don't develop diabetes, you don't develop cancer, because your lifestyle behavior accounts for up to 30% of what can make a difference, according to the World Health Organization. So we need to pay attention. She has shared some studies. I came across some other studies too. There was this study that it was an umbrella review of meta-analysis of prospective observational studies. So this was actually done in China, and they discovered that diets rich in fruits, vegetables, and protective nutrients, they showed beneficial associations. That means they were less likely to develop stroke compared with individuals who were not taking enough of fruits and vegetables. And they said, including among people who had different genetic risk profiles. That means there were some people who actually had genetic predisposition, or they had a history, but because they were able to step down their genes by taking more of fruits and vegetables, then that made a difference. This is another study. There are quite a number of them. This one also showed that individuals who had more than 6 or equals to 6 healthy lifestyle factors, which have already been mentioned: no alcohol or moderate alcohol, physical activity, healthy diet, adequate sleep, healthy BMI, or waist to hip ratio. Sometimes we want to measure your weight because some people will say that, oh, we Africans, our bones are large. We can't be using BMI. But we use waist hip ratio, and we discover that many of our people, their abdomen, shows that they have truncal obesity. So a lot of fat is going to, the abdomen, around the intestines, the liver, and that also increases risk. So those with greater than or equals to 6 healthy lifestyle factors had about 44 lower risk of total stroke compared with those who had less than 2 healthy factors. So what other message do we need to convince us? In fact, I got this one. This is an African study. It was a large multi-center study which involved stroke patients in Nigeria and Ghana, and still the same factors being reiterated. Just like Dr. Olusonya said, hypertension was the strongest modifiable factor. And then we now had other things like diet, physical activity, abdominal obesity, diabetes, still the same things that we've been talking about. So I just want to remind us about these foundational principles that we call dreams. So in the Society of Lifestyle Medicine of Nigeria, we came up with this acronym to remind ourselves, and we always reiterate it whenever we can, so that people can be reminded of the little simple things we can do, to ensure that we're adopting healthy lifestyle approaches on a daily basis. So D stands for diet, R stands for relationships, E for exercise, A for avoidance of toxic substances like alcohol, cigarettes, and smoking, and even this air pollution we're talking about. If you need to change where you live, it's better. M for mental wellness, and S for sleep. So when we're talking about diet, we're talking about a predominantly plant-based diet, whole food plant-based, because you can have an orange. If you take an orange as it is and you squeeze the orange, you eat it, the roughage and everything inside, that is a whole food. But if you squeeze it into a cup, that is a level of processing. It's still your orange juice, but you're removing most of the fiber there. But what is even worse is when we take the one that is in a packet that has come out of a factory, and they say you have concentrate inside. You have fruit concentrate. I don't know how many percent. I stopped drinking those packaged juices years ago. Same thing with those soft drinks, because they're not doing us any good. We're just loading our bodies with sugar. And sugar is as bad as salt, when it comes to hypertension. And it also drives the other chronic conditions that we talked about. So we talked about the healthy food plate, where half of your plate is vegetables, and then 1/4 of your plate is carbohydrates. Dr. Juni had said that, and then another quarter is protein, preferably protein that is not coming from an animal. So, well, when I tell people that I stopped eating red meat some time ago, they wonder that how are you able to do it? How can you? But I enjoy red meat. I love it. But I just discovered that I even just lost interest in it. If I even try to taste it, I can't even say I'm cheating, because I don't even enjoy it anymore. Maybe because of all the scientific studies, all the literature I've read and all of that. So according to WHO, red meat is a grade 2A carcinogen. If it's processed meats like suya, bacon, what other ones do we have? Sausages, bacon, suya, those are the common ones. Those ones even fall into a higher category when it comes to carcinogen. So if you know that you can reduce your risk, why do you want to just keep on taking those things? So whole food as much as possible. You can see the father and the mother. According to one of my friends, you can see the father and the mother. So if it is beans, you're seeing it. If it is yam, you're seeing it. You're seeing the food. You're not seeing meat pie. You're not seeing soft drinks. You are seeing the real food, because it's as close to nature as possible. You are bringing it from the farm, to the table, or from the garden to the kitchen. It's not going through a factory as much as possible, except if it just needs to be packaged. So fiber-rich foods are important. Nuts are also important. Some of us, we need to be intentional about making nuts part of our diet. That's where we have the high-density lipoproteins, which are actually good for us and help to remove the bad fats from the blood vessels, so that those ones don't stick to our blood vessels. So that's where you have your avocado. That's where you have your cashew nuts, your walnuts, very good for the heart, almonds. So we can be intentional. Some people say they're expensive. Yes, they could be expensive, but you don't need more than 2 to 3 handfuls in a week. Instead of sitting down with a whole bottle of groundnut and finishing it in one sitting. So let's try to eat the rainbow, at least 2 portions of fruits on a daily basis as much as possible. It can be one apple, 1 orange. It could be 1 slice of watermelon and 1 slice of pineapple, and along with our fruits and along with our vegetables. And what vegetables do we have? We have garden eggs. We have the local ones, garden eggs. We have oranges, mangoes, things that are in season. And I want to just draw this comparison for us between clean foods and fast foods, because many people think that they are being deprived, of enjoying life. It's like, when I was small, I didn't have access to these things. Now that I can afford it, people are saying I shouldn't take it. Well, if you can take it once in a while, it's fine, so far as you are burning it off. But the reason why I believe that many of us are not burning it off, and it's ending up in our liver, in our blood vessels, and around our intestines, is because of the calorie content, and they are empty calories. So a burger contains 820 calories, no nutrients except for maybe some carbohydrates, which enter your bloodstream very quickly and trigger the release of insulin, which makes you put on more weight. But if you feel like snacking on something, why not snack on a fruit or a vegetable, on a banana or an apple? Just look at the comparison. And these ones contain nutrients. They contain magnesium, potassium, calcium, nutrients that have been shown to be protective, and can actually reduce our risk of hypertension and stroke. So the information is out there for us to take the decision. You just take a pack of chips, you've taken 500 calories. And studies have shown that for you to be able to burn 500 calories, you need to be involved in moderate to vigorous intensity exercise for up to 45 minutes. And how many of us really do that every day? So let's prioritize water, avoid alcohol. We need to take care of our gums as well. Studies have shown that our gums, when they're not healthy, we are more likely to develop hypertension, which is a single risk factor, is one of those risk factors that can be prevented that can be used to, when you control, can prevent stroke. Other things are associated with poor gum health, arthritis, dementia, and diabetes. And then our relationships are also important. So I dwelt on D because most of us, we have to eat. Anywhere we go, any occasion, we have to eat. So we need to make choices about our diet, and we need to take care of our gums, our gum health. When you take all those sugar-laden foods, definitely your gum health will be poor. Then our relationships are also important. Studies have shown that when we don't have good relationships with important or significant other people in our lives, we're more likely to be ill. We are more likely to have cardiovascular problems, more likely to have poor control of our blood pressure and blood sugar. We can age faster. People are even more likely to commit suicide. Divorce has been shown to increase the risk of heart attacks. We talked about exercise earlier. So there are different types of exercise. We have the aerobic exercise where you get your blood pumping, you go on a brisk walk, you are jogging, you are dancing, you are skipping. You need 30 minutes of that on 5 days of the week at the minimum, according to WHO. And just like Dr. Duni said, start small. Don't hit the road with 30 minutes. Start with 5 minutes daily. Add 5 minutes every other week until you get to your maximum. And you find out that even an 80-year-old man can take 10,000 steps in a day. I think my dad is on this call. I'm talking about he's close to 80, and yet he doesn't miss 10,000 steps in a day. Of course, at his pace because of his age, and he's gotten awards, for that. So hopefully we too can get awards. So another thing that is important for us is resistance training or strength training. So you can sit to stand to increase the strength in your core, in your middle, and you can get a resistance band as well. You can do mini squats, calf raises. You lie on your bed and raise your calf or your legs, one after the other. You can do 10 on each side. You can do a plank exercise, which is better than doing a press up, which is also shown in this photo. We also have flexibility exercises. You can spell coconuts with your body. I like doing that in some conferences where I go. And then your mental health is also key. So we have D for diet, R for relationships, E for exercise, A for avoid substances. I didn't go there again because Dr. Olusonya has already dwelt on that. We have M for mental health. And of course, that has a lot to do with our relationships and managing our stress levels. Our mood can be affected if we don't have good support. And when we are stressed, it can be evidenced by people being sad, feeling anxious, not being able to sleep, and feeling fatigued. So if they're having any of these symptoms, please, you need support, either from your family, from your friends, or you might even need to see a healthcare professional to ensure that you are properly managed. And then stress is also important. The way people jump in front of the TV when they're watching football is a serious issue. So studies show that heart attacks doubled in a German city during World Cup. Blood pressures are hitting the roof when people are watching football. Why is there so much anxiety and we're not getting any money from these guys? So we need to take it easy. We need to calm down. Some people need to stop watching football or TV because of the stress that is induced from watching. And then last but not the least, sleep hygiene tips. So if you want to have or enjoy a refreshing sleep every night, you want to enjoy your sleep, you need to limit daytime exposure to natural light. Make sure you have enough daytime exposure, not limit. You have enough daytime exposure to natural lights. So if you stay indoors all day, you don't go outside, no connection with nature, it can affect your sleep initiation. Make sure that if you're having a nap, you're not sleeping after 3 p.m. because it's going to push back your clock and you'll find yourself not feeling sleepy later at night when you want to sleep. Then avoid very late or heavy meals because they can cause indigestion, they can impair the quality of your sleep. Then it's advised that you make your room a cave. Let it be cool, let it be quiet. Don't watch TV in your room. Don't eat on your bed. Make sure that your room is, a sanctity, for sleep and intimacy. Avoid screens 30 to 60 minutes before bed as much as you can, especially for people who are having problems with sleep and who are not waking up feeling refreshed. You might need to do something about TV, news, and TikTok just before bedtime. Avoid drinking large volumes of water before bedtime. So lastly, a question that I get is, will I take medication forever? Many people have strokes because they stop their medication or they forget their medication. They say, oh, my BP went to 150, 80, and so I stopped my medication. Please don't stop your medication. Make sure you take the medication as prescribed. Make sure you go for your follow-up appointments. If it's once in 6 months, it's once in 3 months, it's once in a year, make sure you follow up and you ask questions when unsure. So in conclusion, eat plants, more of plants, which are not processed, closer to nature. Keep moving, sleep well, be present, stay calm, don't blow up and vent and get angry at people, love people more. So many strokes are the final result of years of accumulated risk. But according to the World Health Organization, a healthy lifestyle is a way of living that lowers the risk of being seriously ill or dying early. So these are my references. Thank you so much for staying with us tonight at this LCI webinar. And I hope that you have caught, a few tips, on what you can do to ensure that your lifestyle is preventing you from developing stroke. All right. I hope we're still together. Okay, I'm still sharing my screen. Okay. Okay. All right. Thank you so much, everyone. I'm trying to look at the chat box. Okay. Already you want to help us with, still trying to look at the chat box.
Okay.
Can you help us with the questions?
Yeah, with the questions. Okay. Thank you so much. We really appreciate that, Dr. Duni and Uri. Thank you so much for these very insightful presentations. Okay. The questions are coming in. I'm trying to go to take it from the very top. Okay. Oh, am I seeing questions from last time?
Okay.
Okay. Well, there are a lot of comments.
I can read.
Oh,
okay, I can read now.
You can read now.
Yes,
okay, good. Okay.
I can read now. So, some people are fighting me. Okay. All right. So let me start from the top. So thank you so much, Doctor. Thank you so much, Ma. Thank you so much, Dr. Lusonya. Beautiful presentation. Thank you, Doctor. Please, is taking water late dangerous to our health? Okay. I don't know whether I was one that made a comment that had to do with water. The reason why I said avoid taking water late is so that you don't have to wake up to go to the bathroom multiple times. It will interrupt your sleep. And remember that if you wake up to go to the bathroom once or twice, by the time you get back to your bed, you might find it difficult to go back to sleep. So take enough water, hydrate yourself as much as you can during the day so that you don't have to drink a lot at night. So we just need that to help. We need the sleep. Dr. Duni for a detailed presentation. Ma, how do you... Okay, so I'm going to hand this back to Dr. Duni here. I actually saw something about you want to stop people from watching football. That you, Dr. Duni, this question says, how does air pollution cause stroke?
Okay.
And maybe we can take like two together, or let's take it one after the other. Let's take it one after the other so that they're not
So how
overloaded.
does air pollution cause? Thank you for the question. How does air pollution cause stroke? So what happens is when there is air pollution, we know it's like inhaling particles, because when you smell, they're like particles, and generally particles are known as foreign bodies. So it stimulates what you call oxidative stress as well as inflammatory reactions. Now, when you have, I talked about blood vessels, blood clots occurring in stroke. Why blood clots occur in stroke is because the blood vessels are damaged. One of the primary drivers of damage of the blood vessel is hypertension. Another thing that damages blood vessel is inflammation. So we know inflammation is air pollution. So we know air pollution causes oxidative stress as well as inflammation. So if that is relatively high, it will further damage the blood vessels and increase the risk of having a stroke. I think that's clear, right?
Yes, very clear indeed. So you don't bother yourself about the pathophysiology. Just know that these are what studies have shown. Leave that one for the doctors as much as possible. So, but there is a link, and it's there on the WHO website in case you just want to read more about it. All right, more questions. Some people say it's not good to take injections to treat early stroke, that it will worsen the whole thing. How true is this?
Oh, yes, well, honestly, I don't know I wish I could explain why people are saying this. It is not true. I have tried to understand where that came from. Maybe it would have been able to carry people along and all of that, but it is not true. Injections is usually for, I think, okay, maybe it's a mix-up. Some people have injection damage to their nerves from maybe they injected the sciatic nerve or something, but that is not a stroke. It is an injection error. So injection and stroke, there's no correlation. I'm just trying to know where that came from, but it isn't true. So sometimes people need, in fact, treatment. One of the major ways of treating stroke is by giving IV fluid, giving drugs that will block and that will dissolve the clot via injections. So please, it isn't true, and we need the injections at times.
Hi, Ori. I don't know if it's of any help, but I can actually answer that question with the exact opposite. If you don't treat a stroke with injectable drugs at the point when it gets diagnosed, you run the risk of dying of the stroke. So the whole idea is to be treated as early as possible because time is brain matter. And if you don't act fast, you lose brain matter. It's that simple. So I don't know where as your colleague was saying, I don't know where the idea comes from that it worsens things. No, you die. It's that simple.
Thank you so much, Suzanne.
And apart from that, the bit about the football was a joke, but it's that simply. I know that over here in Europe, you can't stop people watching the football. It doesn't work. There'll be riots.
I know, actually, but some people have told me that they've actually had to stop watching football because their blood pressure goes up. So it's a personal
because
decision.
They get completely stressed about who's winning and who's losing, which is silly.
Exactly. But, yes. So thank you so much, Suzanne. Thank you for joining us all the way.
You mentioned about
all the way from Switzerland, right?
Exactly. You mentioned about changing your relationships. It's not your acronym, the DREAMS, DREAMS. There's a second reason why your relationship is actually really important. There's a Spanish colleague, Mexican colleague actually, he's been posting really interesting infographics recently about lifestyle medicine. And he posted a study that comes from, oh my God, I have to find the origin of the article, but basically it says...
Can you share the article with us in the chat box too?
I
You can also share it with us.
try. I can put it in the LCI WhatsApp group in that one. But it's
Okay.
the infographic is in Spanish. Sorry. But the original article is the spread of obesity in a large social network over 32 years. In the New England Journal of Medicine. Basically simply says, tell me who you live with or who you spend time with, who you surround yourself with, and I will tell you how high your risk of obesity is. If you have people around you who exercise, who try to eat healthy, who try to make differences, etc., it's contagious. It'll make you do the same. That's what they're saying. It implies that you end up making these changes easier because you're following someone doing it in your surrounding, whether it's your couple, whether it's friends, whether it's etc. Doing it alone is hard. Doing it with people is much, much easier. That's the basic message that the thing passes on. But I'll post it to you, and I'll see if I can ask Victor to translate it back into English.
That would be great. Thank you so much, Suzanne.
And thanks for the
we appreciate really that. You're welcome. So we have another question here that says, please, when is the top number normal and the down one higher? I think this person is talking about the systolic BP and the diastolic BP, that when is it normal? So maybe you can just give us a brief insight into the control.
Okay, so the top BP is what you call the systolic, and the lower one is what you call the diastolic. And that's what the person is saying. So if the top one is normal and the lower one is high, you treat as hypertension. So it's 140, 90, at that level you start treating. You treat as hypertension. The top one is when the heart pumps blood. That's the pressure when the heart pumps blood. The lower one is the relaxation, the time in between. So it tells you there is more of hardening, inflammation, atherosclerosis, and all of that. So both will cause that, but usually the lower one talks about the pressure when the blood, when the heart is not actively pumping. So you treat the same. I know in those days when we were in school, they used to say treat the higher one. If the lower one is high, you might wait, but please, we treat the two now because the two have been found to be a risk factor for stroke and other comorbidities.
All right, so that beautifully explains it. So this next question says, is it safe to eat goat meat instead of beef? And I think I want to throw a bit of light on this question. Yes, so if you look at goat meat is actually leaner than cow meat and pork and several other meats. And that's why a lot of people lean towards it, because it means that the calories are less, the total fat, saturated fat, they are less, compared to beef, or meat from from cows. However, on a general note, studies have shown that we should have less of meat from any animal source as much as possible. So it doesn't mean you can't take it at all. There was a population that was studied, a population where they had a concentration of long-lived individuals, and they just tried to look at their lifestyle, their diets, what are these people doing, what made the difference. And the community, they were eating meat 4 times a month. So they had the highest number of long-lived individuals. That means they had individuals in their hundreds, 110, who were not living with chronic disease. They were not living with hypertension, with diabetes. They were not developing strokes and heart attacks. So that was one of the things that they pointed to. And also there's this Adventist study too that, is a prospective study that was on over several years. They discovered that the people who were studied as a 7-day Adventist, they typically don't eat meat. they had lower incidences of hypertension, diabetes, heart attacks, prostate cancer, breast cancer, and all these chronic diseases. So there is a link. So what we're saying is that we should reduce. Many of us, with every meal, you want meat there, 2 pieces of meat. Morning, afternoon, night, you put meat and you feel good that you are enjoying yourself. So please, can we reduce red meat and let's do more of fish, let's do more of chicken and more of fruits and vegetables. All right. So the next question says, what do you mean by gum health? So gum health is a very wide area, which many people are not aware of. In fact, if you go to the dental clinic, they have different specialists, in the dental clinic. They now have the people that their own duty, their own specialty is just to take care of the gum. So gum health starts from what we do when we eat, the kind of foods that we eat, because it affects our immune system. So the gums are just the blocks that they support our teeth. But whenever we have problems with our gum, the inflammation that occurs releases some these toxic substances, which can actually lower our immunity and predispose us to inflammation, as seen in things like diabetes and hypertension. So please, let's brush our teeth properly. Let's avoid those things that can damage our teeth and our gums. And of course, the joke here, you can try to stop people watching football, but I fear success rates will be low. I know definitely. So other a comment saying, thank you so much. Well delivered, Dr. Duni. Thank you so much. Very informative. Very good presentations by Dr. Duni and Dr. Uri Makinde. Thank you. Doctor, what readily available plant protein are there in this part of the country? We have beans, we have lentils, we have green peas, we have mushrooms, we have soya beans. I hope that answers your question. Then thank you, Maz. I appreciate you, Ma. Taking this medication when numbers is at times, I think there's a missing word there. Taking this medication when the numbers are, I don't know whether she meant to say normal, is a time makes someone confused, but we'll continue to take them as explained. Do you want to say something about that?
Oh, yes, maybe I should. I think I got what the person
because
is
people
saying.
think that when their BPs, they think that when their BPs are normal, they shouldn't take medication again.
Yeah, so I think I understand, and I think it's important we answer that. So when the blood pressure became normal because you were taking or you are taking your medications. So when you stop taking your medications, the blood pressure will go up. Now, I know some people will say that, yes, I stopped taking it yesterday or today. I've not taken it for 2 days. It's not going down. It's not going up. So I would say drugs have what you call half-life. It takes time for some drugs to clear out of the system. So if you miss a medication, especially unless the BP, especially for those who don't have difficult to control blood pressure. So sometimes when they miss a dose, the blood pressure is not flying up and you think you are fine. But if you wait long enough and the effect of the medication clears out, you will be back to square zero. So please, if your BP becomes normal on the drug, it shows the drugs are working, and you should keep taking the medications, and that is how to maintain the blood pressure at the desirable range. It's a very good question. Thank you.
I would like to add something to that, because
Yes,
there's
and
a lot
in
of
addition
people
to
who
that,
actually don't understand how serious it is to sort of say, oh, but it doesn't matter, or even after a couple weeks have gone by and then they measure it and they say, yeah, well, I'm still fine. And the problem is blood pressure is that's too high. It's like diabetes. It's something that kills you silently and while you're not noticing, because literally it can take weeks before something starts to get ruined or hurt or damaged. And by the time it is damaged, sometimes it's too late. I always tell people about blood pressure like replacing the plumbing of your house with plastic straws from a takeaway restaurant. The tubing that the plastic straws is made of is flimsy. It's worth nothing. So if I were to offer you a house for free, but I've made all the plumbing with these straws, I'm giving you a poison gift, because the minute you open the tap, you're going to get the wall break into your face. The whole thing is just going to explode and the house will fall apart. The tubing that we have in our bodies is made to have a certain pressure, to hold a certain pressure with the blood going through it. The point is, even with modern day medicine, you can exchange a heart, you can exchange a piece of some of the vessels, but that's all you can do. You can't exchange all of the vessels down to the tiny ones, the capillaries we have that, feed our fingers, for example. Yeah. So if you mistreat the material that you have, that we've been given by the dear Lord, you will damage it in a way that is possibly irreversible. And that's why you do not just stop your blood pressure medication because you think, oh, it doesn't matter, it's okay. I tell people you don't realize until it's too late, because by then the house has exploded and everything's broken.
Yes, and that's why people come down with strokes and heart attacks.
Exactly.
They happen to people who have been on
medication. It doesn't happen overnight. People take time to have the stuff get ruined. It doesn't happen in, a few seconds. It's something that happens over a longer period of time. But if you actually explain to people that you're not going to feel anything in the first, maybe weeks or months or whatever, when you stop taking your medication, you will feel something when you show up in hospital with a heart attack, with a stroke, or with any other consequences of what's happened because your blood pressure has not been under control, or because your blood sugar hasn't been under control.
So I also, thank you so much, Suzanne. I also want to encourage us, because, we also have standards, we have protocols, we have guidelines that we're supposed to use. So for people who are in the stage of pre-hypertension, that means you haven't yet got into 140/90. You're still in the range of between 120/80 to 130/80, or just less than 140/90. You're supposed to be adopting healthy lifestyle strategies consistently.
You have the chance to do something still at that point.
You have that chance.
Yeah, exactly.
So that you don't develop hypertension. Once you have developed hypertension, it's going to be difficult to control that BP without medication. So you will be on medication, at least some level of medication, to control and protect those blood vessels that we're talking about. So please, let's be very proactive. We're going to close in a few minutes from now. I think we'll just take one or two more questions. Someone says that my BP at some point was 90/50, and a nurse alerted me to watch it. Do I need to be worried? I'm 38 years old. So I would say that if your BP is 90/55, we need to know what has been the range all this while. Are you a non-hypertensive on medication? So your medication might need to be titrated so that it doesn't push your blood pressure too low. So you need to see your doctor if you're on medication. But if you're not hypertensive, you've never been hypertensive, and you're having a BP of 90/60, 90/55, for some people it is normal. But it means that you need to be checking regularly to be sure that this is your own blood pressure and that is not dropping. And it also depends on the time of the day you are checking. If you check in the night, just before bedtime, the BP naturally tends to drop to a lower range. But when you check it in the morning, for everyone, it tends to be a bit higher. So I think we'll take this last question. Having only one fruit or vegetable in the morning, a full meal in the afternoon, and a cup of tea in the evening, is this a good practice? I'm asking because it looks like I've lost some kg and I'm concerned. Well, it looks good. It looks fine to me. I don't know the reason why you made this decision, but it's good to have your largest meal during the day so that you don't go to bed on a full stomach. That's good. So if you just want to take a cup of tea at night, it's fine. And you're having enough fruits and vegetables and your meal is healthy, I don't think it's a problem. So if you had lost some weight, because of it's not unusual to lose weight if you reduce the total number of calories. But I think what you should be more concerned about is the nutrients in what you are eating. You know, if you have all the good nutrients we talked about, I don't think you have a problem. All right. This persistent question, can a high level of sugar cause back pain? I don't know the connection between okay. There can be a little connection, but it's not a direct connection. So it's not as if you take sugar right now, you take a soft drink now, your back will start paining you. It's not, that relationship is not that direct. But over time, accumulation of a lot of sugary drinks can also lead to problems with inflammation in the body. And so that can also increase some exacerbations that one might have. But it's not as if you're taking sugar now, it's just going to lead to back pain. Yes. Thank you so much, everybody. This has been so engaging. And thank you so much, Dr. Duni, for answering some of the questions. I can see that you've answered some questions in the chat box. I can see that Suzanne too has also answered some questions. So, wow, it's been amazing. Ore, can you help us to share the WhatsApp link in case we have people that want to join our WhatsApp group, support group, so they can join? Thank you so much, everyone. We do appreciate you staying till the end. All right, so we're going to close it now.